Can you see the screen, ma?
Yes, ma'am.
Okay, fine. So in the demo class, we have seen like what is pharmacology and some terminologies also we have covered, right? Like pharmacokinetics, pharmacodynamics and all, right? So what is pharmacokinetics? What we'll be studying in pharmacokinetics? Like we know like in pharmacokinetics, we are going to study about absorption,
Distribution.
metabolism, distribution and excretion. These four things we are going to study, right? So before that we have like what are the sources of drugs and even routes of drug administration also. In sources of drugs, like we know we have only animal source or the plant source. Only these two things you will be studying in our syllabus. But even we have to study like what are the other sources of drugs and from where you are going to get the other types of drugs or how they can be given or injected into the body and in what way they will be working. Okay. So we have six sources of drugs. These are the six major sources of drugs. One is plant source, animal source, mineral source, microbiological sources. In the sense you will be getting the drugs from the microorganisms. And even we have semi-synthetic or synthetic sources. Semi-synthetic in the sense like 50% you will be getting from natural way and 50% you will be going with addition of any other chemicals or the man-made things, whatever we know. And coming to synthetic, it is completely like artificial. We don't have any natural methods. And last we have recombinant DNA technology. This recombinant DNA technology drugs, so what they are going to do is like some drugs like which are of most or the major cost you can see mostly antiviral drugs. Antiviral drugs you will be getting from recombinant DNA technology. Okay. Now let us see what are the drugs we are going to get from the plants. See, plants are the oldest sources of the drugs. If they ask like what is the oldest source of the drug, it is the plant. And even we all know like in previous days they used to go with Ayurvedic medication. From where we are going to get the Ayurvedic medication? We get it from plant, right? Whatever plants or the herbs or shrubs we have, those plants they'll be going with the usage as a medicine or they'll be going with the massage of the oils what we get from those plants so that you will get the treatment management for that. Okay. And what are the different parts of the plant we can be used as a drug? So here we can use leaves, stem, bark, fruits and roots. These are the different parts of the plants where you can use as a medicine. Okay. So for example, if you see digitalis, you all know digitalis, right? It's a cardiac glycoside. Even we call it as digitoxin or digoxin. So here from where you are going to get this digitoxin or digoxin? You are going to get it from digitalis purpura. And this is used for the purpose of heart so that it can work in a proper way. And even we know that eucalyptus oil or mint, even mint also we will be using in cough syrups. In eucalyptus also you will be using in the cough syrup. And next we have nicotine. Nicotine, we all know like it works as an agonist for nicotinic receptors. You all know like we have muscarinic and nicotinic receptors. So if you go with the usage of the nicotine, this nicotine from where we are going to get it? It is from the leaves of tobacco. And next we have atropine. Atropine, you are going to get it from the plant called Atropa belladonna. So here atropine, like if you see, it can act as an agonist or an antagonist depending upon the part we are going with. Okay, and mostly it works as an agonist also sometimes, and even it will be used in the poisoning cases also. In the sense, it will be working as an emetic also. Okay. Next we have flower. You all know poppy seeds, right? No, poppy seeds, we call it as gasagasalu in Telugu. You know,
Yes,
or, these are nothing but poppy seeds we say. So flowers of poppy, papaver, somniferum gives morphine. Now morphine is belongs to opioid class of the drugs which will be working as a painkiller. See, normally in patients who are going with normal painkillers, sometimes it may give relief, sometimes it may not give relief also. So if they are not getting relief from normal analgesics, they'll be going with what? Morphine. Morphine, codeine, all these they'll be working as strong painkillers. And next, if you see flowers like Vinca rosea, they are going to give vincristine and vinblastin. What is this vincristine and vinblastin? They work as anti-cancer drug. I think you know this, vincristine and vinblastin. Next, we have rose gives us rose water, even which can be used as a tonic. See, if you just go to homeo stores or even some Ayurvedic stores also, you'll be getting the rose water, which can be used as a tonic. And next we have the fruit part. Fruit in the sense here you can go with the example of senna. Senna pod gives anthracene. What is anthracene here? It is a purgative which can be used in the case of constipation. And next we have calabar beans gives us physostigmine which is choliamimetic agent. What do you mean by mimetic or mimic? Choliamimetic agent means it works agonist to the cholinergic system. We say you have we have two systems in the body, adrenergic and cholinergic systems. So it will be working as what? Cholinomimetic agent. And next, if you see the seed part, what kind of plants and their seeds can be used for what? Let us see. Seeds of Nux vomica. I think in pharmacognosy you have studied about Nux vomica. This Nux vomica is going to give strychnine, which can be used as what? CNS stimulant. Next, even we have castor oil. What is castor oil? You know, Amudam. In Telugu, we call it as Amudam.
Yes, ma'am.
This castor oil seeds, it will be used for the purpose of growth of the hair or even as a medicine also it can be used sometimes. Many projects can was done based on this castor oil. And next, even if you take the example of calabar beans, even already we have done this, it is going to give physostigmine, which is a choliamimetic agent. Even seed part can also be used. Now next we have root part. Ipecacuanha root gives emetin, which is used to induce vomiting. In the sense it can be used as an emetic. Sometimes persons will be going with intake of any poison. Not all the poisons. For few poisons it is going to work. If a person is going with accidental poisoning sometime, accidental in the sense unknowingly, if they are going with intake of any poisonous drug or any chemical, we can go with the usage of ipecacuanha syrup. It will be available in the medical shops. So that particular plant can be used as what? Emetic. And next, if you see, it can also be used for the purpose of its amoebicidal properties. What do you mean by amoebicidal? Amoebicidal in the sense it is going to have the capability to kill the amoeba. Cidal means death, right? So amoebicidal properties also we can use ipecacuanha syrup. And next you have Rolfia serpentina, which is going to give reserpine. Reserpine is a hypotensive agent. What do you mean by hypotensive? Hypotensive in the sense it is going to used in purpose of blood pressure purpose, not high blood pressure, low blood pressure purpose. Okay. And next we have reserpine was used for hypertension treatment. If suppose a person is suffering with hypertension, we can go with the usage of reserpine. Okay. From where you are going to get the reserpine? From where we are getting the reserpine? It is
No idea.
Rolfia serpentina only. Okay,
Okay.
from in class 10 itself, we have learned like even Rauwolfia serpentina can also be used in snake bites. Okay, not only for snake bite, even in case of hypertension also, we can go with the usage of this reserpine. Okay, next we have bark. Bark, you can take the best example as cinchona here. Cinchona in the sense, it's like dalchini. You know dalchini?
Yes, ma'am.
Use it in biryani. Okay, so dalchini, that is the structure what we get. Okay, so what are the things we are going to get it from cinchona bark here? It is quinine and quinidine. Quinine and quinidine, which are anti-malarial drugs. You all know, like even in dispensaries you will be getting as hydrochloroquinine. Medication name is HCQ's tablets we say. So in that you will be having this quinine or quinidine. Okay, and quinidine can also be used for like anti-arrhythmic properties. You all know arrhythmia, right? What is arrhythmia? What is arrhythmia? What is arrhythmia? Arrhythmia is like having irregular heartbeat rhythm. See, for beating of the heart, we have a proper rhythm. So, if the rhythm is disturbed, we call it as arrhythmia. Okay, sometimes there will be either one extra sound you will be hearing, or sound may be missed. You all know what are the two sounds we have during the heartbeat, right? So if you are hearing any extra beat, or if any beat is missing, that we call it as arrhythmia. Okay, so for treating arrhythmia also you can go with the usage of quinidine. Okay, next we have atropa belladonna. Already I have discussed this. So which is used as what? Anticholinergic drug. Okay, next you have hyoscyamus niger, which gives hyoscine. Even hyoscine is also an anticholinergic drug. These all examples you have to remember. Okay, which part we are going to use here. In case of bark, what are the three examples? One is cinchona, other one is atropa belladonna, and next you have hyoscyamus. And next we have stem part. In stem part, what is a plant you are going to study? We have chondrodendron tomentosum. It is going to give a tuberculin, which can be used as a skeletal muscle relaxant. I think in pharmacology practical you might have studied about D-tuberculin. Did you study? Did you study?
Yes, ma'am. Yes, ma'am.
D-tuberculin. This can be used as what? Skeletal muscle relaxant in case of general anesthesia. See, if a person is given this general anesthetic, this tuberculin can be studied as what? Skeletal muscle relaxant. So that was the sources of drugs from the plant. Now let us see animal sources. See what are the different animals we use to get different types of drugs here. Like first is insulin. Okay. So what is the use of insulin? Insulin will be used to treat diabetes here. So from where you are going to get this insulin? Let us see. See, pancreas is a source of insulin which is used in the treatment of diabetes, and even HCG, human chorionic gonadotropin. This can be used in case of what? Infertility. Okay. What do you mean by infertility? If a woman is not able to produce the ovum or ova, that particular case we call it as infertility here. So for that purpose or in such kind of women, we can go with the usage of what? HCG. And next, sheep thyroid is a source of thyroxine used in hypertension. Not only hypertension, if a person is suffering with any thyroid gland problem, so they can go with the usage of this thyroxine. And next, cod liver. See, this cod liver, they will be using even in cooking also. So this cod liver is an excellent source of what? Vitamin A and vitamin D. Next, even you can go with usage of anterior pituitary. Anterior pituitary is a source of what, like pituitary gonadotropins. Even that can also be used in infertility treatment. And sometimes blood of some animals is used in preparation of vaccines also. Next we have like enzymes. See, our stomach is going to produce many enzymes like trypsin, pepsin and all. But for few members, like these enzymes will not be produced in a proper way. So for them, what they will do is they will be giving these enzymes so that they'll be having a proper digestion. Okay. So nowadays what they are doing is like instead of going with animal extracted enzymes, they have searched with any alternative ways from where we are going to get these enzymes. Okay, and now let us see mineral sources. Mineral sources in the sense like is there any usage of minerals in our body?
Yes, ma'am.
What are the different uses of minerals?
It helps in the formation of bones,
Yeah, bones, yes, good. Next. Next.
water balance,
Yeah, next. Okay, fine. So we have different uses of minerals in our body, but for few people, what happens is like sometimes they are going to show deficiency of minerals also. Okay, so for that purpose, what doctors are going to do, they are going to give some medication which is related to that, and these medicines they are of which origin? Mineral origin. Okay, now let us see like what are the different sources of drugs from minerals. One is metallic and non-metallic sources. What is this metallic and non-metallic sources? Let us see. First thing is iron. We all know like iron is going to play a major role in the body in the formation of hemoglobin, right? So if this iron is not available in the body, can we produce hemoglobin? No, we can't produce. So for those people, what doctors will do is they will be giving either the iron tablets or iron injection so that iron deficiency can overcome. Okay. And next we have mercury salts. Mercury salts can be used in syphilis. What is syphilis? It is a sexually transmitted disease, right? Syphilis, gonorrhea, AIDS, these are all one sexually transmitted diseases. So for treating syphilis, what they'll be using? They'll use mercurial salts. And next we have zinc. See, zinc plays a very important role in the body. So this can be used as a zinc supplement. Supplement in the sense if you don't have enough zinc in the intake of food, then you can go with the usage of zinc tablets. And not only that, zinc oxide paste can be used in treating some wounds and in eczema. You know what is eczema? What is eczema?
no, ma'am.
Eczema is like allergic reaction where you will be seeing on the skin. You call it as atopic dermatitis. Okay, you will be seeing the symptoms like itching and even rashes on the skin, especially on the cheeks, arms, and even legs. Also, you will be finding. Sometimes even it may affect the vaginal regions also, so that we call it as eczema. Eczema can be treated and we have treatment options available both in allopathic medication and even homeopathic medication also. And next is iodine. Iodine can be used as an antiseptic. See, we know like whenever we are going with any stitches on the cut wounds or if any major surgery has to be done, they'll be going with spreading of iodine there. Okay, so this iodine will be working as what? Antiseptic. That is the reason you will be going with rubbing of iodine on the cut wounds. And sometimes they'll be going with iodine supplements also. so that any deficiency of iodine for the purpose of thyroid gland can be replaced. And other one is like gold salts. Gold salts can be used in the treatment of rheumatoid arthritis. Rheumatoid arthritis in the sense, it's an autoimmune disorder where it will be affecting the knee part. Manak mokala noppulu antaru. I think you heard this. Did you hear?
Yes, ma'am.
So gold salts can be used in treating the rheumatoid arthritis. Next we have miscellaneous sources. Miscellaneous in the sense like you can get it from other sources also rather than plants, animals or microbial agents. All these if you just put aside, we have other sources of drugs also. One is miscellaneous source. Let us see what is this miscellaneous. Fluorine, right? Fluorine is an element like generally we'll be using in water. Fluorine content can be seen in water. This fluorine is also having antiseptic properties. See from the above slides what we have studied is fluorine is having antiseptic property, iodine is having antiseptic property, right? And next we have borax also. Even borax is also having antiseptic properties. Next you have selenium. Selenium sulfide is used in anti-dandruff shampoos. See, you will be getting many brands of anti-dandruff shampoos where they will be adding selenium sulfide as one of the ingredient. Next you have petroleum. Petroleum is used in the preparation of liquid paraffin. Liquid paraffin has many uses. If you just put liquid paraffin aside also some petroleum jellies you will get like Vaseline and all, right? So in that they will be using what? Petroleum as one of the ingredient. Next let us see what are the semi-synthetic or synthetic sources of the drug. So if you see here, how we are going to get this semi-synthetic or synthetic sources. Semi-synthetic in the sense like you can see when the nucleus of the drug obtained from the natural source is retained but the chemical structure is altered, we call it as semi-synthetic. See, the drug will be from the natural source only, either from the plant or animal, but one or two of the molecules of that particular drug will be modified. Modified in the sense they will just remove and put other molecules so that it can be worked for some other purpose. Examples we have apomorphine, diacylmorphine, ethinyl estradiol, homatropine, ampicillin and methyl testosterone. So these are some of the examples where you will replace one or two of the drugs with its chemical structure. Suppose if it is having any functional group that will be removed and other moiety will be attached so that it will be working for some other purpose but not the purpose what it has already done. And next if you see the anti-anxiety drugs, anti-anxiety drugs. What is the purpose of anti-anxiety drugs? What they will do? What anti-anxiety medication will do? Did you remember anti-anxiety drugs?
No, ma'am.
No? Okay. See, anxiety in the sense like a person will be worried much. Okay. And anti-anxiety medications are given to calm down the person. Calm down in the sense if he is worrying a lot and even if he is thinking a lot, not sleeping in a proper way or suffering with insomnia. So for them they will be giving with anti-anxiety drugs. Best examples of anti-anxiety drugs we have clonazepam, alprazolam. Did you remember?
Yes, ma'am.
So these are some of the examples of anti-anxiety medications. So these medications, what we are using for anti-anxiety or convulsions in the sense the seizures and all you might have studied. So these drugs are semi-synthetic forms. Semi-synthetic in the sense we got it from plant source or the animal source, but we have replaced one or two molecules from that. Okay, so those are semi-synthetic forms. And next, if you see synthetic forms here, synthetic in the sense purely they are you will be replacing all the molecules or whatever modifications you want to have, you will do it. Not one, two molecules will be replaced. Most of the things will be replaced in case of the synthetic ones. Okay. Now let us see what is a synthetic drug. When the nucleus of the drug from the natural source as well as its chemical structure is altered. So what we are altering in case of synthetic, you will alter the nucleus as well as total chemical structure whatever it is having. What is semi-synthetic? What is semi-synthetic?
Source and structure both are altered, ma'am.
No, what you will alter in case of semi-synthetic? Is it total structure or only some of the structure will be altered?
Total structure, ma'am.
In case of synthetic or semi-synthetic?
Semi-synthetic.
No, in case of semi-synthetic, only chemical structure will be altered. In case of synthetic means total it will be artificial only. Both nucleus as well as chemical structure will be altered. In case of semi-synthetic, nucleus will be the same but chemical structure will be altered. Is it clear?
Okay, ma'am.
Okay. So in case of synthetic sources, what examples we have? One is emitting bismuth iodine. This is the best example where its chemical structure as well as nucleus is altered completely. Next we have microbiological sources. In a sense, you will be using microorganisms as the source of the drugs. Different microorganisms like fungi, bacteria, these will be used. So you have an idea about penicillium notatum, right? Penicillin. What is penicillin?
It is antibiotic, ma'am.
Yeah, it is an antibiotic and we have different penicillins like penicillin G, penicillin D, like different penicillins you might have studied in your bachelor's, right? So these penicillins, we are going to get it from a fungus called as Penicillium notatum. And next we have actinobacteria gives streptomycin. Even this streptomycin is an antibiotic. And next we have aminoglycosides. From aminoglycosides such as gentamicin and tobramycin are obtained from streptomyces and micromonosporas. So from where you are going to get this gentamicin and tobramycin? Streptomyces as well as micromonosporas. This gentamicin is a well used antibiotic in hospitals. Like if you are suffering with any small infections, and even sometimes like some infections cannot be cured with other antibiotics, for them they will be going with gentamicin as an alternative. Okay. And next we have recombinant DNA technology. What is this recombinant DNA technology? Here you will have one DNA and that DNA segment will be cut using some enzymes like restriction endonucleases and all. Once it is cut, and again you are going to go with attachment of the desired DNA for that. Desired DNA in the sense which can be incorporated into anything. That desired one is going to show the effect for you. Okay, now you can see here the desired gene is coupled to rapidly replicating DNA. The desired gene in the sense, here you can go with what do you call the DNA which works antagonist to any virus or bacteria like that, and it will be attached to the replicating DNA. See, whenever you are cutting any segment of the DNA, again it is going to replicate in the sense it is going to add up the nucleotides and nucleosides, whatever nitrogen bases we have, that will be formed, everything will be done. Okay. Now, once you are attaching the new DNA segment to the old one in the sense where you have removed a part of the DNA segment and you are going to add up a new DNA segment there. Now here these two are going to become a new genetic combination because previously the second DNA segment was not there, right? So after attaching, what happened? It is going to be incorporated or inserted into the bacterial cultures, which allows the production of vast amount of genetic material. And once it is produced, it is having many advantages. One is like pure form can be obtained. Pure form in the sense we are not going with adding up any adding up or alteration in the chemical structures like that. And next, it is less antigenic. Now coming to disadvantages, if you see, first thing, it should be done in a very careful manner. We can't go with normal ways like that. It should be like prepared in a well-versed laboratories, and even a skilled person is to be required. Skilled person in the sense he has to know where to cut the DNA segment and where to add the DNA segment and what nitrogen bases has to be removed. All these things, in which direction he has to cut. We have from 5 prime to 3 prime direction, 3 prime to 5 prime direction. All these things he has to know. Okay. And next thing is, it is a very complex and complicated technique. Complex and complicated in a sense, what do you mean by complex and complicated?
Very difficult, ma'am.
Yeah, very difficult. You can't easily go with that particular cutting of the DNA segment, adding up of the DNA segment, incorporation. Even incorporation also has to require much patience. Okay, so if there is no skilled person, they can't go with the usage of this recombinant DNA technology. Okay, like for example, you can go with the drug of rituximab, which is an antiviral drug. All these see even in case of cancer therapy also, they will be going with the usage of the drugs. What we get it from recombinant DNA technology only. Okay, rituximab, all I think you might have remembered, like all mobs, zumabs, all these will come under anti-cancer drugs. Okay, so whatever, why? Because these cancer therapy is a little bit related to this only. We have to stop the growth of the cancer growing cells, their multiplication has to be stopped, or they should be removed from the body. See, we can't go with the complete removal of that particular cancer from the body, but at least you can stop the multiplication of the cancer for a certain period of time. Okay, so this is about the recombinant DNA technology as a source of drug. Is it clear?
Yes, ma'am.
Okay, we'll go with little practice. I will give you some questions also. Please solve it today if you are having any doubt. Yeah, let us see some questions. Even answers are also given. Only few questions we'll see, not much. Anyway, I'll give the other questions for you. Science which deals with the drug and their action on the human body is called. So we know it is pharmacology. And next,
Ma'am, the screen is not visible.
screen is not visible. Oh, okay, wait. Is it visible now?
No, ma'am.
Visible? No.
No.
Okay, wait. Visible?
No, ma'am.
No. I am sharing. Can you see now?
Yes, ma'am.
Okay. We'll see some questions today. Second one, you see. The study of absorption, distribution, metabolism and excretion of drug is known as, what do we call? We call
Pharmacokinetics.
pharmacokinetics. Okay. See, kinetics in the sense, you should remember what body is going to do, in the sense what a drug is going to go with in the body. Okay, so that is pharmacokinetics. Next we have the science which is concerned with the study of mechanism of the drug and pharmacological effects produced on the human body is called as, it is
Pharmaco
pharmacodynamics. Okay, so here what a drug will be doing after entering into the body. Next, the substances produced or derived from living organisms that are used to kill bacteria or prevent their multiplication is called, what do you call? We call
antibiotics.
antibiotics. Drugs are excreted from the body through kidney, breast milk, saliva, sweat and bile, intestine, all the above. It is all the above. See, we know the major organ in our body for elimination of the drug is kidney. But there are some drugs which will be eliminated or excreted through breast milk, saliva, sweat and bile. See, elimination of drugs through these ways is of little proportion, not much, but they'll get eliminated even through these ways. Intestine, in the sense, you should assume that it is through the rectum. You know, through the fecal matter also some amount of drug will be eliminated. I think some of the drugs what we have studied in 3-1 semester or 3-2 semester, you will get like elimination or excretion way is by fecal matter. Only little proportion, not 90%. 90% of the drug will be eliminated through urine only, that is through kidney only. But some amount of the drugs can also be eliminated through intestine. Okay. Now, which of the following is a source for obtaining drugs? Animals and plants, microorganisms, synthetic origin, all the above. So we have seen these three, right? Animals and plants, microorganisms, synthetic. So the answer is what? All the above. Now let us see the next one. The rate of absorption of a drug is affected by. Absorption in the sense, you know, like once the drug enters into the body, it is going to bind to its receptor site, then it will be absorbed. So how or what is the factor which affects the absorption rate? Let us see. One is route of drug administration. What do you mean by route of drug administration? you have different routes like parental route, oral route, rectal route, or transdermal patches. Okay, intravenous, intramuscular, all these will come under parental routes only. So that is routes of drug administration. Solubility of the drug. Solubility of the drug is different for acidic and basic drugs. See what all drugs we have in the market. They are acidic drugs and basic drugs. Okay, in the sense they will get soluble in acidic medium or basic medium like that. That is solubility we say. Next is site of administration. Site of administration in the sense if you go with parental route sometimes they will be giving only at specific sites. I think you might have observed in the hospital. Some injections will be given on the hand and some injections will be given on the back of your vest. I think you have seen. Did you observe?
Yes, ma'am.
So that is the site of administration we say. So all these factors, whatever I told you now, that is the route of drug administration or solubility of the drug or site of administration, these all are going to affect the rate of absorption of the drug. Next, putting a drug in the liquid form into the body cavity or body orifice is known as what? Inhalation, instillation, insertion or insufflation. So mostly we know about inhalation. What do you mean by inhalation? What is inhalation?
Breathe intake.
Yeah, you are going to take it with the help of the nose or mouth, especially anti-asthmatic drugs. But here what he is saying, putting a drug in a liquid form into a body cavity or body orifice. Orifice in the sense like a socket like structure you can imagine. So that we call it as instillation, not insertion or insufflation or inhalation. Okay, what is that? Instillation we say. I think you might have observed putting eye drops into your eye sockets and all. That is in the liquid form only, right?
Yes, ma'am.
Next, application of the drug to the skin, usually by a friction, is known as what? It is not insertion. Insertion in the sense what you are going to insert something into your body. Like if you go with any endoscopy, laparoscopy and all, they will insert some pipes into the body. That is insertion we say. Insufflation is again different. Instillation already I told you. What is instillation? Whenever you are putting the liquid form into the body cavity or body orifice. And next we have inunction. Inunction is a term what you will be using for application of the drug to the skin. You will be rubbing the ointments or the creams or the skin, right? Next we have nitroglycerin is administered by which route? What is nitroglycerin? What is nitroglycerin? It will be used in case of heart attacks. You know, myocardial infarction or angina pectoris, you know. What is angina pectoris? What is angina pectoris? It is the episodes of
Oxygen to the heart.
yeah, when oxygen is getting reduced, they'll be suffering with the episodes of the chest pain, right? So for them, what they'll do is they will be giving nitroglycerin tablets so that that particular chest pain can be relieved within 5 to 10 minutes, not more than that. So this nitroglycerin will be given by which route? It will be given by sublingual route. What is sublingual route? Sublingual is putting under the tongue. Like under the tongue they will be putting the nitroglycerin. So it is going to escape the first pass metabolism also. Okay, so whenever you are giving by parental route or sublingual methods, it is going to escape the first pass metabolism. That is the reason the onset of action will be very fast. It is not slow. So when the onset of drug action will be slow, by which route? Whenever we are going with oral route. Oral route, it will take more time to show its action. I think you know this. Okay. Next, when the drug is introduced in the bone marrow, this route is called what? Intraperitoneal, intrathecal, intramedullary and intra-arterial. See, intraperitoneal. What do you mean by peritoneal? You know peritoneum. What is peritoneum? Peritoneum is related to which system in our body? Peritoneum is related to digestive system in our body. Okay, so what they are saying here, they are talking about bone marrow here. Bone marrow, is it present on dorsal side or ventral side? It is present on dorsal side, right? Back of the body, you will be having the bone marrow. But peritoneum will be present on the ventral side of your body. Ventral in the sense the front part of your body. So this A option is wrong. Next, intrathecal. Intrathecal is different again. Intra-arterial means it is related to heart. You know this, vessels. So the other option what we have is intramedullary. Intramedullary is related to what? Introducing the drug in the bone marrow. That is intramedullary we say. Okay. Now next, when the medicine is administered into the spinal cavity, this route is what? Intrathecal, intraosseous, intraperitoneal and intracardiac. So the option is what? Intrathecal. If you are giving it into the spine, you know when we are going to give the injection in the spine, do you have any idea in which situation you will give the medicine through the spinal cord?
When the spino fluid is less, ma'am.
That is one situation. And even when a woman is going with a C-section, you know what is C-section?
Yes, ma'am.
So for them also, when they want to give the anesthesia, they will be inserting it into the spinal cord only, back of your body only. They will be giving the anesthesia. Especially they will give bupivacaine injection. Okay, bupivacaine is an anesthetic, right? So they will measure a certain amount of bupivacaine injection and they will give through this way. Now, test dose of penicillin is administered by which of the following route? Subcutaneous, intravenous, intramuscular, intradermal. So here penicillin is an antibiotic, we know this. Subcutaneous is beneath your skin. Okay. Intravenous means inserting it into the veins. Intramuscular means through the muscle, and even the angle of injection will also be different for these different routes of drug administration. And next we have intradermal. Intradermal in the sense it will be very deep. Okay. So here the test dose of penicillin will be always tested by only one route, that is intradermal we say, not subcutaneous or intravenous or intramuscular. It is totally intradermal. Okay. Next you see here, this question I think you can answer. When a drug is administered through the layers of the skin into areolar tissue, this is known as what? Through the layers of the areolar tissue. Intradermal, intraatrial, subcutaneous, intramuscular. Okay, so what do you call? We call it as subcutaneous administration. Subcutaneous in the sense, you know cuticle, right? In our skin we have epidermis, dermis, cuticle and all. Okay, so you just remember like that, subcutaneous administration. where the drug will be administered into the deep layers of the skin. What do you call where the drugs will be used to relieve the pain? Is it antipyretic or analgesic?
Antipyretic is used to decrease the temperature of the body, so it is analgesics.
It is analgesic. So whenever we are using the drugs to relieve pain, we call it as analgesic. Reducing fever, what do you call?
Antipyretics.
Yeah, antipyretic. Good. Now, what are the drugs we call for treating the convulsions or epilepsy? Is it antihistamine, anticoagulant, anesthetics, or anticonvulsants?
Anticonvulsants.
Yeah, anticonvulsants. Now, substances used to treat the poison cases. What do you call?
Ant-
Antitussives, antidotes, anti-inflammatory, anesthetics.
Antidote.
Yeah, antidotes. Now, drugs used to destroy and expel worms. What do you call?
Anti-helmintic.
Yeah, anti-helminthics. A drug which can be used to relieve itching. What do you call? Antiseptic, antipruritic, anti-infective, anti-inflammatory. It is antipruritic. You know pruritus? What is pruritus? You know pustules? What are pustules? Pustules అంటే తెలుసా?
No, ma'am.
What is pustule, ma? See, see, whenever we get any allergy or you know chicken pox or smallpox,
Yes, ma'am.
you will get pustules on the skin. చిన్నగా మనకి దద్దుర్లలాగా అవుతాయి, చూసావా ఎప్పుడు గమనించారా?
No, ma'am.
No. See, in chicken pox on the skin you will get small rashes. Rashes అంటే పెద్ద కాదు, చిన్న పుండ్లలాగా అవుతాయి, చూసారా?
Yes, ma'am.
Those are pustules we say. If you are treating that pustules, we call it as and those pustules will be little bit itchy. కొంచెం దురద కూడా వస్తాయి అవి, కానీ we should not go with itching. Okay, instead of going with itching, we can go with the usage of antipruritic. ఏదైనా ఒక మెడిసిన్ మనం ఇచ్చింగ్కి ఇస్తున్నామంటే యాంటీప్రూరిటిక్ అంటాం. ఓకే, drugs which are used to prevent or relieve nausea and vomiting, what do you call? Emetics or antiemetics?
Emetics, ma'am.
ఎమెటిక్స్ కాదు, యాంటీ ఎమెటిక్స్ అంటారు. ఎమెటిక్స్ అంటే వామిటింగ్ని తెప్పిస్తాం. ఏ సిచ్యువేషన్లో వాళ్ళు వామిటింగ్ వాళ్ళు పాయిజన్ తీసుకున్నారు అంటే we will go with the usage of emetics so that they are going to vomit the poison what they have taken accidentally. Okay, next we have an agent used to increase the level of hemoglobin content in the blood is called. What do you call whenever we are using any drug to increase the level of hemoglobin? We call it as hematinics. What do you call them? Hematinics. హిమాటినిక్స్ అనే డ్రగ్ మన బాడీలో హిమోగ్లోబిన్ కంటెంట్ని ఇంక్రీజ్ చేయడానికి యూజ్ చేస్తారు. ఓకే, యు నో డెక్సోరెంజ్ సిరప్? డెక్సోరెంజ్ విన్నావా?
No, ma'am.
వినలేదా? డెక్సోరెంజ్ ఇంకా హీమప్ సిరప్స్, ఇవన్నీ కూడా మన బాడీలో హిమోగ్లోబిన్ కంటెంట్ని పెంచడానికి. ఓకే, నెక్స్ట్ drugs which are used to increase the urine output are called. యూరిన్ని ఎక్కువ చేయాలి అంటే ఏం యూజ్ చేస్తాం? యాంటీ హైపర్టెన్సివ్, డయూరిటిక్స్, Antidiuretic hormone, none of the above.
Diuretics.
Diuretics, good. Next, drugs which dilate the blood vessels are used to lower blood pressure. ఏమంటాము?
Vasodilators.
Vasodilators. We don't call them as mydriatics or myotics. Next, cardiotonics are the drugs used to treat
Heart,
uh,
related to heart disease.
related to heart disease. That is, they are going to increase the heart rate and even the force of contraction also. Next, antizyolitics are used for what? Antizyolitics are used to treat anxiety. Okay, antizyolitic agents or anti-anxiety agents, we use them to treat anxiety. Okay. Next, mydriatics are the drugs which are used for what? Constrict the pupil, dilate the blood vessel. Mydriatics, they are going to dilate the pupil of the eye. Okay. Next, what are myotics? See, myotics are the opposite of mydriatics. Now you say me, what are myotics?
Contraction of
Yeah,
people.
they are going to constrict the pupil of the eye. Hypnotics, I think you have remembered sedatives and hypnotics, right? So what these hypnotics will do? Will they relieve the anxiety or induce the sleep, reduce muscle tone and cause muscle relaxation, or all of the above? Sedatives and hypnotics, did you remember?
Yes, ma'am.
What they will do? They are going to induce the sleep in our body, right? The persons
Yes.
who are suffering with insomnia, they will be giving these sedatives and hypnotics. Okay, so hypnotics are the drugs which are used to induce the sleep. Next, galactogog is a drug. What is this galactogog? Increase breast milk secretion, increase blood glucose level, decrease blood glucose level, increase appetite 198. This is the one which is used to increase the breast milk secretion. In medical shop, you will get one bottle called as Galact granules. ఎవరికైతే ఏ ఉమెన్కి అయితే బ్రెస్ట్ మిల్క్ సరిగ్గా రావట్లేవో ఫర్ దెమ్ దే విల్ గో విత్ ద యూసేజ్ ఆఫ్ గెలక్టోగాగ్. ఇవి టాబ్లెట్స్ లాగా ఉంటాయి, క్యాప్స్యూల్స్. ఆర్ ఎల్స్ you will even get a powdered form where they need to mix with the milk and they have to drink. So whenever they are doing so, the breast milk secretion will be increased. Okay. Now, which vitamin is also known as anti-sterility vitamin? Which vitamin is called anti-sterility vitamin? We call it as vitamin E. Did you remember vitamin E? That is the anti-sterility vitamin. For what purpose vitamin E is used? It is used for anti-sterility. What is sterility? What is sterility? What is sterility? If they are not able to produce sperms or ovum, that situation we call it as sterility. Is it clear?
Yes, ma'am.
Sterility?
It is used during the
Yeah. You just if a woman or men not able to produce sperm or ovum, we call it as sterility. For them, they will be giving the vitamin E tablets so that they will not have sterility. Okay. in following, which is the advantage of intravenous drug administration? What is intravenous? Administering a drug through veins, we call it as intravenous, right? So what is the best advantage of the drug which is going with intravenous drug administration? One is useful in emergency conditions. Large volumes of solutions can be administered. There is a very rapid response of the drug. All the above. So why it is all the above? Let us see. One is useful in emergency conditions. Emergency in the sense, what if a person has met with an accident and we need to go with the immediate response of the drug, like reduction of the pain or some other situations also. In that conditions you can use IV route. And other thing is large volume of solutions can be administered. Suppose if I give you like 1000 ml of the drug, can you go with oral administration?
No, ma'am.
No, we can't go. But if you go with IV method, you can go with not only 1000 ml, even you can go with 2000 ml also, like administration of normal saline or ringer lactate or DNS, all these things. Okay. And next thing is there is a very rapid response of a drug. What do you mean by rapid response?
Quick response.
Yeah, quick response. See, if you are giving injection, immediately within 5 or 10 minutes, the pain will be relieved or the fever will be relieved. Okay, so that is the reason we get a rapid response when a drug is administered by IV route. So these